welcome everyone. Thank you for joining A4M in partnership with Virtual Practices for our masterclass webinar series on how to set up your practice for success during the COVID era and beyond. We also like to thank tonight's sponsor, Microbiome Labs. Should anyone have any questions, please type them in the chat box, or you can email your questions to impact@virtualpractices.org. Tonight, the fourth edition of our webinar series titled Capitalizing on Testing in the COVID Era will be presented by Tom Bloom. Following this presentation, Dr. Pamela Smith will lead a presentation on the importance of stool testing. Our expert, Mr. Tom Bloom, is a serial entrepreneur and recognized thought leader on the design of novel approaches to accelerate the application of emerging science and research in the day-to-day practice of medicine and personal health management. He is the co-founder of virtualpractices.org. Now with you, Mr. Tom Bloom.
Well, thank you, Gina, and welcome everybody. To, I guess this is our fourth conversation over the course of the last couple of weeks, and tonight's conversation is kind of a special one in my mind because it represents what actually was probably the single hardest part about creating the resources at Virtual Practices, which pertain to testing. And as many of you remember, I'm sure, when this entire ordeal began, testing became, was number one, non-existent, and then became so incredibly scarce in the early days as the demand for COVID testing quickly absorbed all of the tests that were available and sent to the front lines. And so, it was an early challenge for us to get access to the type of testing that we actually needed. I'm happy to say that over the course of, I guess it was about a month ago, we landed in a place where we were actually really happy with the testing resources that we have, both on the diagnostic side, but also on the antibody side, but and also in a preventive context. So we're going to talk about a whole family of different type of tests. We're going to talk a little bit about testing infrastructure as well, and then well, let me walk you through our objectives for tonight. So, as I have said at the start of every one of these things, if you haven't done so, and I have to imagine you probably have if you've been to any of these so far, go ahead and register at virtualpractices.org. As I always talk through these resources, Lori will put up in the chat where to find these things on virtualpractices.org. So everything we discuss is there, including all of the information on how to order testing and all of the details that and materials that you'll see over the course of the next little while as we talk. So we're going to talk about how to access the latest testing resources. We're also going to talk a bit about testing infrastructure for the COVID era. You might recall in our very first discussion in this series, as we talked about practice infrastructure, we did touch very much on the topic of testing and not allowing lack of forethought and planning to cause you to accidentally derail care paths that patients might be on. So we'll talk a little bit about solving that. Then we're going to talk a bit about exploring employer opportunities, because the subject of testing is actually, this is actually where, interestingly enough, the doors open for smaller independent practices, maybe for the first time in our kind of professional lives, to really have an open invitation to begin to engage in relationships with employers. So we're going to spend a little bit of time talking about that as well. As always, whether during the course of this conversation tonight or after we're done, if you get confused about anything, can't find anything that you need, this email address, impact@virtualpractices.org, is at your disposal to do with as you wish. We really will reply, so feel free to send us an email if you have a question or you need help with anything at all. And then a bit of foreshadowing. Our next and final session in this series is one that brings everything that we have discussed kind of together, and where we call it conveniently Launch, Restarting and Growing Your Practice in the COVID Era, but we'll get very into the tactical, all right, what do you do with all of this and how do you bring this together, hopefully for impact not only on your practice, but in your community. Now tonight we actually have an extra sort of bonus module of content at the end of the conversation that I want to share with you I'm gonna compress this a bit and we'll skip over some of the Q&A. So if you have questions, log these in the chat as we go, and Lori will attempt to answer them, and we can always try and get back to you as well. But the sort of special treat at the end of the conversation tonight is this one. We have a couple of friends of mine actually that run a company called Microbiome Labs. Kieran Christian and Tom Bain created this company. It's turned into something that's actually quite spectacular, and they are going to be introducing us to a new microbiome sequencing test called Biome FX. It's as they put it, a functional microbiome analysis, and they have recruited a real rock star to kind of walk us through this, Dr. Pam Smith, who many of you probably know, but if you don't, is an author of many books, a speaker, a functional medicine and anti-aging expert that that has nearly a quarter century of just deep experience in our world to sort of walk us through what is I suspect going to be kind of revealed as a bit of a next generation microbiome test and report. So I'm kind of excited myself to hand over the microphone and sit back and listen to what this team has been able to accomplish in the form of this new testing. So anyway, so that is something to look forward at the end. Now to get started. Now, as you've probably gotten accustomed to since we've gotten started with this whole discussion, I like to begin with touching on which of the 5 really key COVID lessons we're going to be touching on tonight. And the first one is this lesson of anticipating future disruptions. As we've discussed, this is something that sort of probably feels a bit obvious by now, but it's just a reminder that we can't kind of proceed into the future imagining that things are going to magically resolve, and that we need to really anticipate that the fall may be very chaotic. And so let's not take our foot off the gas, and let's not sort of relax our resolve to putting into place the necessary measures to make sure that going forward into the fall, that whatever the chaos may be that ensues, that it actually serves to elevate the practice, your practice and your training and your ability to create value in the COVID era and in your community, and potentially with employers as well as patients and new patient relationships. The second thing we're going to talk about is and we're going to touch on is the acknowledgement of trends. And you recall that I had said that this was an interesting lesson to be taught and to think about, because ours is a community of early adopters and very curious people. And in many ways, I think when it comes particularly to some of the practice implementation concepts and new technologies, many of us have been following these things with great interest, but have found reasons to sort of delay putting these things to work and into practice. And so I think what we've learned from the COVID crisis is that, look, when we see something that's an obvious trend that's moving forward, that it may very well make sense for us to begin to not only be early adopters from an intellectual standpoint, but from an actual practical standpoint as well. And so looking at, as I hope by now we've all probably got some sort of a telehealth virtual consult tool put into place. We're recognizing this trend of kind of healthcare moving into the home, which frankly touches very heavily on tonight's topic, because this notion of health moving into the home applies very much to the subject of testing. And again, this predates COVID. If you look back, several years at this point, the regulatory and cultural winds have been blowing very much in the direction of consumer empowerment, people ordering their own lab testing through direct-to-consumer lab testing sites, and beginning to learn almost how to interpret and apply those lessons from lab tests themselves. And so building on that kind of theme of healthcare moving into the home, testing moving into the home, all of the neat acceleration. You've got to imagine, as I am, that one of the consequences of this whole COVID crisis will be yet a further acceleration of home testing and novel methods of collecting blood and preserving blood, so that we can expand the array of potential tests that can be run through home collection of samples. And then, of course, we have the digital health kind of revolution, and the maturity of sensor technologies and the interoperability of data that allows us now to bring it all together in a single dashboard. Lots and lots of interesting trends that I think now most of us have the motivation and insight to work on and apply. Then finally, we're going to talk, and this topic really relates to the fragility of engagement models, which is, I know, something that we've been talking about over the last couple of conversations. But the way I kind of perceive the relationship between testing and engagement is that for so many patients over the last few months, their care paths have been interrupted because of the logistical challenges of getting testing done. And so I think one very attainable goal for us as we talk and move into next week and the remainder of summer is to put into place the measures that would prevent that from happening again. And I think that between home testing and the use of mobile phlebotomy, we really have no reason for testing to derail a care pathway and cause patients to feel disconnected and disengaged from the practice. And so we're gonna touch a bit more on that tonight. So getting started with this discussion, actually, I want to begin by talking about some creative possibilities that pertain to the prevention side of the care path. And so you all remember, and if you haven't downloaded or gone and kind of taken a closer look at the care path, you'll find it in the COVID era section of the Virtual Practices site, and you can download the PDF and have it. But you remember that this is a care path that breaks into two forks into two branches, one of which is symptomatic patients and infected patients, and there's the care and surveillance side of that path that we'll talk a bit about. But the other is the preventive side. And the preventive side is kind of exciting because number one, it is applicable and can be really overseen and delivered by most any type of practitioner, really invites the use of care teams, coaches, nutrition professionals in partnership with physician practices. It's a really interesting side of the care pathway. And we're going to talk a little bit about some of the creative possibilities that exist here that really have been brought about by testing. And so it's hard for me to kind of talk about the marketability and commercial viability of a preventive care path without acknowledging the meaning of this graphic that I'll unpack for you here right now. I will say honestly, I don't think I've ever really, with much enthusiasm, kind of pushed on the opportunity to commercialize pure prevention. And the reason for that is, and it has to do with the adage that's captured in this image, which is the old adage, and I believe this is an old adage in the venture capital community, is that it is a lot easier to sell an aspirin than a vitamin. And I think this is certainly, many of you have probably experienced this in your efforts to grow and promote your practice. But it is historically very difficult, I have found, to attract new prospective patients to a proposition that involves the avoidance of something that they have not yet experienced. And so, if you've ever done, for example, a workshop on heart attack prevention, and looked at the attendance of that, and then you reframed the content around, let's say, weight loss, and it's basically the same content, but you're doing it on weight loss. Suddenly, a much bigger crowd shows up for your workshop, and so there's an exception in the case of COVID to this kind of rule, and I'm hoping to kind of invite all of us to take a second look in this one instance at the marketability of prevention, and the reason for that is that the entire public has been absolutely bombarded with deep education, probably a bit of sensationalism in terms of the danger that they're placed in. I mean, it's not to trivialize this, but I mean, the media tends to focus on and elevate the most extreme cases of younger people who are debilitated or killed by COVID. And we are so, I don't think there's ever been a time in any of our professional lives when the public has been so well educated on risk factors. I mean, they're so literate in all of this. And so we are in a really unusual window of opportunity where there is a very real segment of the population that has a very unusually heightened focus and appetite on prevention of COVID. And so thinking about how that applies to the tools that we've assembled for you, we've done a handful of things. Now the general theme of what we've tried to accomplish with the preventive care path, and quite frankly, this is a theme I think that like most all of what we're talking about is absolutely applicable to most any kind of health related program that you would create. But in trying to catalyze behavior change and lifestyle change among people, in the effort to prevent COVID or anything else, it is very nice and helpful to gain traction in that endeavor by being able to sort of engineer some quantitative goals and measures of success. And so there are a few things in this world that do a better job of that than lab testing. And so when the crisis began, and we began to get a very clear sense of some of the lifestyle-borne risk factors that applied to COVID. One of the first things that we did, I reached out to a company called imaware that does some really, really innovative work with home testing and home testing kits, and asked if they would develop for us a panel called that we gave the name Lifestyle Risk Check, and it's a panel that, as you'll see in a moment, I'll sort of unpack the details of it. But it's very well suited for people that have been on quarantine and possibly breeding new kind of COVID related risks out of the quarantine experience. Then we have introduced a genetics panel called the Respiratory Resilience Panel that allows us to tap into an altogether different segment of the consumer population. And then finally, we've been able after a lot of effort to access a couple of different forms of the COVID antibody testing, which we're going to talk again about in a fair amount of detail. But frankly, antibody testing is another really, really great way both to attract customers as well as prospects, existing patients and prospects, and to use the findings, be they positive or negative, to transition the discussion into really taking action around prevention. And so we're going to talk about how each of these three types of tests can become growth engines for your practice. So we'll start with this Lifestyle Risk Check, which was the very first of the kits that we actually had a hand in developing ourselves. And this was really a great experience with this company because not only did they allow us to define the markers in the panel, which, as you can see here, are hemoglobin A1C, glucose, HSCRP, and vitamin D, but they allowed us to impose kind of functional target reference ranges as opposed to relying strictly on conventional reference ranges. So we were able to be a little bit more kind of optimal and aspirational with the target range to give practices something to help patients really shoot for. And so in this case, the audience for this, as you might imagine, are people there. There are two types of people out there when it comes to quarantine. There are those that have used quarantine to absolutely live their very best life, and they're gardening and meditating for 2 hours a day and exercising for an hour, and they've never been healthier. And then there are the folks like me that are so unaccustomed to sitting at a desk all day when they're used to be traveling that it's like the quarantine's been very disruptive, and so there are folks probably breeding insulin resistance as they're sitting home in quarantine. So this is a test more designed for that audience that may actually be increasing in their kind of COVID risk profile as a result of lifestyle disruption from brought on by COVID. And it's a simple $89 test, easy to order. It's at lifestyleriskcheck.com. And the findings of it, of course, are all very, very heavily impacted by lifestyle change, things that you can accomplish remotely through nutrition and behavior change and coaching and the like. And so our desire, and I think we accomplished this nicely, was to create something that would give traction to any kind of lifestyle change and coaching program. Can be done individually or in groups. Then we have that other group in the world of quarantine that it's the health activated group that again, they've never been healthier, and so they're not sitting at home kind of wringing their hands wondering if they are expanding their risk profile for COVID. And for this more health activated group, we were really excited to unveil this respiratory resilience genetics panel from Toolbox Genomics. And so what this panel does, it was really cleverly designed, is it looks at genetic predisposition for low levels of vitamins and nutrients that are known to be immune supportive, And so we've got, you're looking at vitamin D and C and vitamin A and zinc. And then it looks at genetic variants that lead to propensity for other known risk factors, hypertension, blood sugar dysregulation, et cetera. And so it brings those together. And so for that more health activated person, you've got a way to expose them to risks that may be kind of beyond their control and hidden beneath the surface, and a way to stimulate their curiosity and sort of cover bases that they wouldn't otherwise have known to cover. And again, it's an easily accessible and affordable test through Toolbox Genomics. So a great combination to allow us to cover the whole kind of gamut of preventive candidates. So then that third pillar is the antibody testing, and this one was interesting and a tricky one for us to sort of pull together for a couple different reasons. Number one, we were looking for two things that have been themes really throughout our search for tools for independent practices to add value and create value in the COVID era. And the big one was we really wanted to be able to support practices that were working entirely virtually around COVID testing. And then the second was we really wanted to have access to one of the very few high quality rapid antibody tests. And then of course, what's not shown here, but we can access now is phlebotomy drawn antibody testing. If you're drawing blood in the office, of course there actually now are some really great possibilities for that as well. But I want to focus on these two because they have so much possibility that comes with them. So I'll start with the one on the left, which looks exactly like the Lifestyle Risk Check. It's the same kit from the same company. And this is a home collection antibody test, IgG and IgM. And I want to make sure that I'm very clear. It is home collection, but it is not a direct-to-consumer test. I don't believe we are likely to see COVID antibody testing ever become a consumer-initiated test that's entirely done at home. And the reason for that is that the consumer is probably not ever going to be really well equipped to understand and act on results. So for example, if people are IgM positive, recognizing that signifies in all likelihood they may still very well be contagious and actually need to now go get another PCR test to see if in fact they're still actively infected. There are just some decisions that come on the back end of antibody testing, as well as an explanation of immunity that is just going to be better delivered by a professional. And so I think that these are all, while home collection is a real possibility now, I do think it's always going to be professionally initiated. And so this is not an exception to that. So this is a test you would initiate, but can be sent to your patient's home and collected through fingerstick, and then the results come back and you review those results with the patient. The possibilities then also, it's not, you can do this for larger populations. And as we'll talk in a little bit about employer opportunities, a test like this is pretty exciting. The other is the rapid antibody test. And as we've seen over the last few months, there have been a flood of these that have hit the shores of the US. Most of them have been complete crap. And in fact, the FDA has advised that many of them be simply removed from the market because I think it would not be inaccurate to say many of them are downright fraudulent tests. In this particular case, there are a few that have been validated and have done quite well. We were able at last to access them through a company. This one called through a company called Grayson Corporation. I found this one. It was funny. In fact, a couple of the different tests that I'm going to show you, we found in the course of being beaten in employer-related deals with people in the virtual practices Facebook community as they've been approaching employers. Sometimes I'll get involved in helping with the conversations, and in this particular case, there was an instance where we lost an employer deal, and I was able. They were nice enough to tell us where it was that they had sourced this other test. And I was able to reach out to that company and arrange for our community to access the test. And so this is it's a $30 kit, and it's about a 10 or 15 minute test. Actually, I have a typo here. It's not a typo. It needs to be updated. The minimum order quantity on this is actually dropped to 50 kits. It's not 100. And so the way it works is it's a finger stick test. It's not a self collection. It's you drop a few drops of blood into that well, a couple of drops of reagent behind it, wait 10 minutes, and then, in sort of pregnancy test form, you get your IgG and your IgM bars that light up along with the control bar at the top. And so anyway, because of the form of the test, I was kind of dubious about it when we got started. I ended up, beyond looking at the validation studies that the company had done, I actually wound up by chance speaking with the physician in Chicago who had actually gathered and submitted the data for this test to the FDA. And I must say, I came away feeling very, very confident that this is actually a super high quality test. Interestingly enough, even using this device, this guy happened to be in a pure insurance-based practice. He'd had really positive results with payers reimbursing for it, and you can see here the payment ranges. And I think his best payer was Cigna, totaling between the finger stick and the test itself at $135 for the test. We're going to talk in a little bit. I'm going to show you how the encounter form workbook that we have actually has the testing codes, so that if you're not billing insurance, you can still hand that encounter form to patients after you do your testing and have them collect. So anyway, but if you think about it, the cool thing about these rapid tests is that you are present when the answer comes back, and so it prompts the discussion. The great majority of people, of course, are going to get a negative antibody test, and so now that's a person who is, by definition, they're concerned enough about this to have gone out of their way to get the testing and to pay for the testing, and now they are finding out, probably to their own chagrin, that they're antibody negative. And now is the opportunity for you to talk to them about okay, other preventive measures that they can take, since they don't have any form of immunity yet to COVID. What can we do to manage risk? And it's a great opportunity to introduce the preventive care pathway, as well as nutritional supplements and other measures that you might have readily available. Now, here's maybe my favorite of all of them, only because it represented the biggest pain in the neck to gain access to it. We lost. There was another deal that we had been pursuing in the state of Virginia, where we lost, and we had a really, really great, this practice had lined up a wonderful solution using PCR testing with swabs, and they'd lined up the protective equipment. They were going to be able to do an on-site event, and lo and behold, in this employer's case, we lost that deal because they had been so drawn to the salivary testing. And you might remember, actually, kind of early on in the COVID crisis, Rutgers University got the approval for this salivary test, the very first one, and the test wound up being contracted with a lab called Spectrum to run it, and so anyway, when we lost this deal, I was like, how in the heck does this company get access to the test? Sort of traced back where in the world Rutgers had licensed the test, and found that there were a couple of now licensed distributors. One is this company, OneHealth.io, which I was stunned and appalled to see, because I actually knew the CEO of that company. And so anyway, I reached out, and now we have through this page, and this is I know it's a long link, but it's accessible to you in the testing area of the virtualpractices.org site. Here you have the only, to my knowledge, link on the planet that will take you to a page where you can send a patient, and the patient can order and pay for their test, have it sent to their home. They collect the saliva sample, send it back in, and get the result. This is also not a direct-to-consumer test. It is a physician-initiated test. The compliance people that work with me on this were of the opinion that because this page it's not searchable, you're not going to stumble upon it. The only way a patient would be there is if they were sent there by a practitioner. That this was a compliant way to go about this. Now, what's also very, very neat about this is that you can order large quantities of these. So if you are working with an employer, or you need a bunch of them sent to an address or whatever for a group screening, you can do that as well. So they can be ordered one at a time or in bulk. So this is a really neat and handy resource, I think, for you to make use of. Now then, this is not really a test as much as it is an interesting approach to sort of help patients screen themselves, and for you to screen people in your medical records. But we were doing a webinar with the founder of Toolbox Genomics, who happens to be a pharmacist by training, and the conversation turned to when she was talking about genetic propensity for low levels of certain immune supportive vitamins and nutrients. The conversation turned to drug nutrient depletions, and the extent to which certain drugs depleted known immune supportive vitamins and nutrients. And so when that call was over, I wound up sort of fixating on this and went out and lo and behold did some homework, and there actually are many drugs that are known to deplete immune support nutrients, which you see listed here. And so some of the big culprits, probably the most interesting culprit, and interestingly now there's been a study to surface to sort of validate the use of long-term use of PPIs as a risk factor for COVID. And of course the likely reason for that is the inability to absorb a number of immune supportive nutrients when you're taking PPIs over long term. Anti-inflammatories is another one, but as you kind of sift through this list, which you can pull this off of Virtual Practices, you can download this and look at it. But if you can imagine, this gives you an interesting way of and kind of new way of reaching out to patients and prospects and kind of getting people's attention by virtue of the drugs that they may have been on that they've never associated with a COVID risk before. So kind of an interesting idea. Now, if you now wrap all this together and think about the various solution kits that you can create with the tools that we've now talked about, you've got this really interesting menu of testing. You've got a really, as we discussed last week, and I'm going to show you, actually, we got some questions as I should have anticipated last week. So I'm going to show you in a moment the ingredient labeling on the next slide on this immune defense kit. But you've now got at your disposal something, a combination of tests, nutritional supplements through Wellivate, and then I've got this question mark here, which signifies whatever else you want to add to that solution bundle. And what we're seeing people do most often is when dealing with consumers, there tends to be a content, educational aspect to that bundle. Of course, if you're dealing with people that are infected, there's the service side of surveillance and monitoring them at home. But on the preventive side, there's people doing food plans and recipes and shopping lists and other lifestyle coaching kind of content to help people shift their risk profile quickly while they're living in quarantine. So there's lots of possibilities here. Now to give you what I failed to give you last week, I'm hoping you can kind of see this, but my point in showing it is that kit is very cleverly designed. And the way it works is that people order the box, which has 3 bottles in it, 2 of which are not intended to be taken by patients that are non-symptomatic. So the purple and the orange one you set aside, and you simply take this green bottle every day. And as you can see from the ingredients here, this product lines up really nicely with the nutraceutical protocol that we laid out for you at Virtual Practices, broken into those 4 quadrants. And these are therapeutic doses. And so when you do the math actually on what it takes to for people to buy these one active ingredient at a time, what you discover is actually there's an enormous amount of savings in buying it in this kit. And then should people ever become symptomatic, immediately they have access to the boosting supplements that that they've set aside. So it's a really cleverly designed thing that I hope you will go and put this in your Wellivate store. Find it in Wellivate. It's Wellivate's been kind enough to sponsor alongside A4M this entire program. So it's a pleasure to be able to call your attention to this. Now, as I'd mentioned, this all kind of comes together in the Encounter Form Workbook. Now, I know the Encounter Form Workbook is an Excel document, and nobody loves to just go chasing after an Excel document, but I hope you'll chase after this one. So if you go to Virtual Practices, you go into the back office section, and you find the Encounter Form Workbook, you'll find that this Excel document has a tab for every touch point in the care pathway. And you'll also find that at the bottom there are the lab services related codes that would enable you, if you are doing antibody testing or PCR testing, it will enable you to print this off, hand it to a patient, and allow that patient to do the work of submitting their own claim. And in this kind of once in a lifetime way, because payers are being so accommodating around helping to shield patients from the financial impact of COVID, people are getting wonderfully reimbursed for their PCR testing and their antibody testing. So I really, really encourage you to go ahead and use that and download and use that Encounter Form workbook, because it completely blunts the financial impact of almost everything we're talking about for your patients, even if you are not contracted with insurance, as I'm sure probably many of you are not. Now we're going to just talk for a moment about this notion of testing infrastructure and making sure this is really a reminder to make sure that as we move into the remainder of summer and fall, that you put into place the necessary measures to ensure that you're not losing patient engagement because of an inability to get testing. And so I want to introduce you to two resources here that we've come across. One, I expect many of you already know already, which is Evexia Diagnostics, which is a really interesting company it's sort of a shopping mall of labs that are commonly known in the sort of root cause medicine circles. And they also claim to have a network of about 6,000 mobile phlebotomists. And so, so there's an avenue there to get testing done and to facilitate mobile phlebotomy. If you've ever worked with networks like that of mobile phlebotomists, you realize the challenge that any company would have in creating predictability and consistency in that experience. And so a number of practitioners we have found kind of would prefer if they could just have a person in their community that they knew was their go-to mobile phlebotomy person. And in that case, we have a company called Specialty Sticks Mobile Phlebotomy, the CEO of which is a woman named Heather Mayhew, that we ran across actually in pitching an employer deal out in the Sacramento market. And lo and behold, this woman proved herself to be quite remarkable actually on orchestrating mobile phlebotomy, not only in Northern California, but elsewhere. And she agreed to make herself and her company available if you would like to find a mobile phlebotomist and are having a hard time accessing one in your community, you just don't know where to look. She has invited you to have her email address and phone number and to reach out, and they'll assist you essentially in sourcing a mobile phlebotomist that you could form a relationship with and have kind of a dedicated person that is your go-to that you can feel confident in. So anyway, so between these two resources, I would hope that there's really no need for you to have any patient feeling as though they can't move forward in a care path of any kind as we head into the fall with whatever the fall, whatever awaits us in the fall. So now we're going to touch, and I'm going to give you sort of a taste of what we're going to dive much more deeply into on Tuesday, but thinking quickly about how we put these to use. So we have a few kind of campaigns that I'm going to talk about. One is this idea of an antibody testing campaign. And I love the idea of this one because it enables you to invite you to sort of make an announcement to patients, prospects in your community to come into the office. We're seeing that, and frankly, this has been the case since the moment that sort of stay-at-home orders began to relax. We've been seeing that even when it was purely phlebotomy-based antibody testing, that many people would come out of their home and come back to the doctor's office for antibody testing. I was having a conversation with the CEO at Boston Heart Diagnostics, who's doing the COVID testing for Eurofins, and he was telling me, he's like, it's been very interesting to see how many of our antibody samples have come packaged with our whole advanced cardiovascular array. And so patients would come in, they're like, well, while I'm at the doctor's office, I might as well touch on a few other things and, get my, check on cardiovascular risk or whatever. So they were finding that the practices were using that encounter to do a much more expansive sort of preventive visit. And so I would certainly suggest that you consider the same to the extent that you're drawing people back into the office. Of course, we have also talked about, as we've been talking over the last couple of weeks, other ways that are important to use these patient touches over the summer to make sure that people know how to implement your your virtual infrastructure. So if you're using a telehealth tool with an app, let's make sure they've downloaded it. They know how to self-schedule an appointment if you're inviting that, and that they are pre-trained, as we've been discussing, to kind of flow with the practice in various ways as things open and close in the coming months. And so this is a really interesting way of doing this in the office. And then the exact same thing can be used to do antibody testing out of the office. So if you're completely virtual and you want to be able to sort of scratch the itch of patients and prospects that are really wondering if they may have had COVID at some point in the last couple of months, we have the I'm Aware test that allows you to do the exact same thing and consult with people remotely. And I would remind you that it's interesting. We did an interview with the CEO of Diagnostic Solutions Lab. I don't know, maybe 3 or 4 weeks ago, and it was actually quite interesting to talk to him about the concept of immunity, because I had, prior to that discussion, sort of thought to myself, well, we're really waiting. We're looking for patients that are testing negative for antibodies as the prospects for your preventive care programs. And he made the very good point, which was that over the course of time, of course, these antibodies begin to fade, and there's actually very good reason to think that it's not at all a bad idea, at least on the nutritional supplementation side, to go ahead and make sure that you're properly kind of fortified from an immune nutrient support perspective. And so this, I just continue to think that antibody testing for consumers is just a really, really great way to initiate discussions and actions around the preventive care pathway. And then we have other we've got the respiratory resilience panel targeting health activated patients. We've got that lifestyle risk check for people that are on quarantine and breeding risk factors out of lifestyle and quarantine, and of course drug nutrient depletion. Now this then takes me to the final chapter of this conversation, and then I'm going to turn it over to Pam to talk to us about a next generation microbiome testing. But talking about employers, as I've mentioned a couple of times in our discussion together, there has, to my knowledge, never been a time in at least in our professional lives that there has been a better opportunity for small independent practices to enter into relationships with employers, where there's a real appetite for employers and oddly enough, a real willingness for them to work with a smaller, more nimble practice, as opposed to just going and contracting with the hospital. And this is something that was brought to my attention, interestingly, also by Boston Heart, because they were discovering that they were actually needing the help of some of their smaller practices that were running their advanced cardio panels in working with employers to get COVID testing implemented quickly. And so the benefit that you guys have is multifaceted. Number one, you're nimble and quick and a bit more entrepreneurial than the traditional contractors that deal with companies. Second, you're unusually literate in COVID testing, as well as what to do about COVID testing. So you're you've kind of got a great knowledge base to actually function in a way as like a contracted chief medical officer for a company that finds itself suddenly in a position of having to make decisions around testing and huge resource expenses around testing and vigilance around a completely new disease. And so anyway, do not dismiss yourself as actually relevant and very qualified in this moment in time to work with companies. So the scenarios that companies are facing, as we see on the news, are said that you can really work on are several. There's back to work. Of course, you've got all these companies that have legions of people staying at home and they're trying to bring them, or at least portions of them, back into the office to sort of resume a more kind of conventional work life. Then there are the inevitable scenarios, and there will only be more and more of these as we get into the fall, where there are needs for waves of testing, either of the entire company or departments in the company, in response to either symptoms or exposures. And then there are, for certain types of companies that need to be hypervigilant, there are their needs for testing shifts and departments, if not the whole company, on a proactive basis periodically, as we're seeing in places like nursing homes and assisted livings. And so when you think about what you can do to help these companies, you've actually got a lot of tools at your disposal. And not the least of which is the menu of tests that we've just talked about, and the ability to do diagnostic testing in particular without having to bring an army of people and protective equipment onto the work site or into the parking lot to do these drive-through screenings. The ability to do testing like that, while people are at home, to equip practice or companies to have some of these kits on site so that they can hand them in the event of an exposure. They can proactively hand them to folks, and then you're there both to interpret results and also to kind of maintain the registry of antibodies and infected and resolved cases, et cetera. By extension, there's a big cost management component to that, and the fact that employers are very vulnerable to whatever claims whoever might be making about a test. And so, decisions around that, decisions around what to do on the basis of certain results. What do you do if someone is IgM positive? And I mean, do you in fact have them do another PCR test? So lots and lots of decisions that, just like consumers, employers are no better equipped to make than a consumer would be. And so then I think that where really you distinguish yourself from other resources in the marketplace is the ability to actually add value in either scenario of a person's infected and you have the ability to support them and avoid the massive costs that can occur when patients are at home panicking and in and out of the ER thinking that they're having trouble breathing, and that just running up tens of thousands of dollars in bills that could be avoided with proper support. And then, of course, the support that, and knowledge that you have to transfer to patients around both blunting the effects of an infection and preventing it. So there's lots and lots of value. And I will tell you, it's timely that we're talking about this, as day before yesterday, I was in a conversation. It was our largest employer discussion we've had to date. This is a company with about 25,000 employees and locations, more than 100 locations scattered across the country. And what was fascinating was their number one pain point by far was turnaround time on PCR testing. And so my sense was, again, they're a very distributed company. My sense was they were trying to utilize Quest and LabCorp. Well, LabCorp, as you may have seen in the news, is running like a 6-day getting 165,000 samples a day. They can't expand nearly fast enough to meet demand. And so this really is a time where employers can't look down the street to the draw stations for Quest and LabCorp, and they need to be doing much more innovative things. And again, these are the tests we've discussed tonight are lesser known, although very, very appealing. And so I really hope that you might summons the nerve to kind of test the waters with patients who might own businesses, chambers of commerce, et cetera. And we're going to talk a bit more about that on Tuesday. But I really do hope you'll start to give some thought to it. I want to now introduce you to one other resource that you're going to find on Virtual Practices if you are interested in working with employers. We made what essentially amounts to a webinar it's an educational webinar that is intended for you to give to a chamber of commerce or an employer, essentially educating them on COVID testing. And as a part of this education, of course, we're setting the stage for them to want to work with a smaller, more nimble practice with the capabilities and resources that you have at your disposal. And so you can download this. You don't have to leave it in our template. You can copy and paste it into your own. But it's a really interesting resource that I'm hoping will be very useful to some of you. I know that a number of folks are using it already now. And so anyway, I really do invite you to download that and have a look at it. So let's talk about our homework, and then I want to hand this over to Pam. If you haven't done it already, as you can tell, a lot of the implementation discussion occurs in our Facebook group, so go and join it. If you haven't done so already, hunt down that immune defense kit in Welevate. If you want to learn more about the details of it, you can find it at protectwellness.com, and you can learn anything and everything about it there. I am hopeful that you will pick, not all, but pick one of these initiatives to try out and sort of stick your toe in the water on that. And again, as always, if you're interested in working with employers, of course, look at the resources we have, but also just let us know, because as you can tell, we're very excited to see the practitioners in our community kind of embark on these new frontiers of relationships with companies. And then last but not least, send your questions to Virtual Practices or impact@virtualpractices.org. And I will see you on Tuesday for our wrap-up discussion where we get completely tactical with what we're going to do about all of this. It's really one of my favorite talks in the entire series. So now I am excited to introduce Microbiome Labs and Dr. Pam Smith to unveil for us what I have a hunch, just because I've heard Kieran at Microbiome Labs talk about the microbiome before, and there's no one better at doing it. So I've got a hunch we're in for a real treat around what Pam's going to have to show us. So Pam, welcome, and I'm excited to hear what you have to say.
Oh, thank you so much. I appreciate it, truly. What we're going to do is take a few minutes to look at the idea of GI health. And I know a lot of you who are on this evening, welcome, welcome. And I know you think that all I talk about is hormones. But if you ask me, is it more important that the patient is hormonally sound, or is it more important that they have good GI health? I will basically tell you it's the same. It's equally as important. 70% to 80% of the immune system is in the gut. And that's because 80% of the lymph nodes in the body are in the GI tract. So you are what you eat. The cells of the GI tract are shed and replaced every 3 to 6 days. So therefore, they're very sensitive to nutrition and lifestyle choices. So again, just a little bit of science. There is not a single patient in my practice that has not had a gut health test, because it's so important. Not only is it the immune system, but B12, biotin for hair and nails, serotonin, the happy neurotransmitter, 90% is made in the gut. So what are some signs of poor digestion? Less than 1 bowel movement a day, undigested food and stools, foul-smelling stools, feel better if the patient doesn't eat. You've all had patients who've said that. Chronic indigestion after eating, poor sleeping habits, waking up tired, frequently cold for no reason whatsoever, depressed with no reason, they burp, have gas, bloated stomach, they feel stressed without a cause, they need to loosen their belt after eating, even though they haven't overeaten, increase in pulse of 20 to 25 beats within 15 minutes after eating, chronically coated tongue. Those are bad signs. So what are some signs of optimal digestion? The first one on here is the one my patients are always shocked at. And by the way, our practice over the years has had a relationship with 2 different companies where we went in and provided health care for them. So the idea that you just looked at is fabulous to look at. And people are always shocked at 2 bowel movements a day is normal. It is. I had a patient today that was new to me, and she said, I'm lucky if I have 1 bowel movement in an entire week. No undigested food in the stools, stools that do not smell. Patients feel good after eating, and several hours later, they sleep well, they wake up, and they feel rested, and they have warm extremities. They also have good energy throughout the day. No extreme food cravings. They feel better after exercising, and they don't have the mood swings, shakiness, anxiety, and depression. So these are nutrients that are commonly involved in the gut. So different inflammatory diseases people can look at, but dysbiosis is a major problem. So these are symptoms of dysbiosis. All of us have had patients with many or even all of these symptoms, but you may not be as familiar with the extra-intestinal symptoms linked to dysbiosis. Arthralgias, anxiety, brain fog, cognitive and mood deficit, depression, anxiety, fatigue, fever of unknown origin, frequent urination, malaise, myalgias, palpitations, phlebitis, pruritus, skin rashes, even seizures can be an extra-intestinal symptom linked to dysbiosis and vasculitis. So what are causes? Low levels of hydrochloric acid, repeated use of antibiotics, carb malabsorption, food allergies, use of non-steroidal anti-inflammatory drugs, alcohol abuse, corticosteroid use, pancreatic insufficiency, excessive stress, and consumption of infected foods. All of these as well. GI surgeries, immune deficiencies, nutritional deficiencies, improper fasting or dieting, free radical production, alcohol abuse, diminished bile, travel, yeast infections, virus, lectins, hypoxia, or extreme altitudes. We all know that non-steroidals break down the intestinal wall, as do viruses of all varieties. Lectins are protein fragments of foods that are not completely digested. They bind with specific sugars on the surface cells throughout the body. That excessive alcohol use that I mentioned, the new definition by the CDC is for women up to 1 drink a day, for men up to 2. After that, there is a disruption in the tight junctions in the cells lining the intestines, which increase membrane permeability. So common causes of dysbiosis: loss of good bacteria, loss of vitamin production, loss of, or consequences, loss of detoxification, loss of chemical and antibiotic protection, overgrowth with harmful species. All of these are consequences of dysbiosis, which leads to leaky gut syndrome. So there's an increase in intestinal permeability. So toxins and medications can go back into the system. Common conditions associated with leaky gut. I'm not going to bore you this evening by reading all of them. I put them here for your perusal, but they are in alphabetical order. So you can see that the first slide we only got to see. So we'll start out with acne. And all of these. And these. So how do we fix the gut? It's really important to do a gut health test. And when we do one, and I'm going to go through a new innovative GI test at the end of this presentation, but we want to be able to have the 5R program of gut restoration. We want to remove, replace, repopulate, repair, and rebalance. So we've always talked to people about this in our practice. Now we're actually advertising that part of the way that we want to help people build their immune system is to do a gut health program with us and a gut health test. So first of all, you want to remove whatever's either an excess, allergen, etc. You want to replace. Once the offending food, lifestyle triggers are removed, then you want to replace what is necessary. Gastric acid may actually be low. Many people have hypochlorhydria, so they have small bowel overgrowth, dysbiosis, chronic candidal infections, mineral deficiencies like calcium, magnesium, zinc, iron, chromium, manganese, copper, molybdenum, and B12 deficiency. So these are common signs and symptoms of low gastric acid. Again, my patients are really surprised to find this out because many of them are on a PPI when they come to see us. And these diseases are associated with low gastric acid. Common things and not so common. You notice on this slide is autoimmune diseases. Every single patient in my practice with an autoimmune disease, and there's now 105 of them, with chronic Lyme being the 105th. All of them, I do 3 things. 1, no gluten. 2, I do a gut health test and fix the gut. 3, start low-dose naltrexone. So every single one of them, whether it's celiac disease, whether it's eczema, psoriasis, Hashimoto's thyroiditis, vitiligo, it doesn't matter. So if they have hydrochloric acid that's low, we do want to replace it. Many of these patients have pancreatic insufficiency, which is due either to their lifestyle, their eating habits, they don't chew their food well enough, or the aging process. And then people do have an increase in developing allergies. Pancreatic insufficiency, according to this trial, does occur with age. Common signs and symptoms: post-prandial bloating, pain, or nausea, a half an hour to several hours after eating. Low stomach acid, given pain immediately after eating. So post-prandial bloating, this is really, really, really important. And you can look at the rest of these. Digestive enzymes enhance digestive health. They also reduce autoimmunity. We want people to have the right immune system. We don't want them to be hyperimmune and have an autoimmune disease. We don't want them to have a low immune system. So many people do need digestive enzymes. What are causes of depletion? Pesticides, pasteurization, irradiation of food, etc. Even cooking at high temperatures, microwaving, radiation, electromagnetic fields, sitting in front of them right now actually, fluoride in the water, heavy metals, root canals, all of these can cause enzyme depletion. So conditions that enzymatic therapy is effective for: maldigestion, malabsorption, pancreatic insufficiency, steatorrhea, celiac disease, lactose intolerance, and even arterial obstruction, ischemic heart disease, thrombotic disease, inflammatory disorders, and rheumatoid arthritis. Clinical Pearl. Digestive enzymes, if taken with food, they improve digestion and help heal leaky gut. If they're taken on an empty stomach, they have anti-inflammatory action. So when you prescribe them for the patient or suggest them, think about what are you trying to do? Are you trying to improve digestion or use digestive enzymes as an anti-inflammatory? Bile salts are also important. There's a lot of symptoms of low bile salts like bloating, gas, abdominal discomfort after eating a fatty meal. Replacement of bile salts, really most people only need to take them for 2 months and never again. Repopulate, restoring the balance of good bacteria in the gut, it is key. So we look at probiotics initially for 1 month, and then we give prebiotics. We don't want to start them together because if you give prebiotics initially, it will feed both the good and bad bacteria. So start with probiotics for the first month, then add on the prebiotics. So FOS, for example, would be a very good one. Probiotics maintain the optimal pH of the intestine. They help with detoxification. A lot of times people forget that the gut is an organ of detoxification. So people with severely compromised immune systems should not use live probiotics. Be aware of that. You do want to repair. The gut lining can be severely compromised due to inflammation, stress, and who isn't stressed nowadays? Exposures to allergens as well. So glutamine is very good for repairing the gut. It's also excellent for immune support. Fasting for some patients has been found to be beneficial. And don't forget, in order for all of this to work, the body does have to have optimal energy balance as well. The ATPase activity does affect absorption in the body. Rebalance. When lifestyle comes into play, it's very important to address the external stressors in your life that may increase your sympathetic drive in the nervous system and reduce the parasympathetic drive. So those are the 5 keys that everybody should look at for the gut. So again, all patients, really, we should do gut health testing and repair the gut. If I have a patient who comes in to see me, I did a PBS special last year on memory. Do I look at memory? What do I start with? 2 things, hormones and gut health. So there's many ways of looking at why you would want to have a healthy gut. There's now a new kind of GI testing out that has a new way of looking at things. And this is the BioMe-FX testing. So you want to make sure you look at taxonomy, but now we can do whole genome sequencing. The science is here to now do this. This is a very exciting development in medicine because now we can customize and individualize the care for every single person. So diversity, of course, is key. You want to look at the gut microbiome index, which is just a good overall way of looking at gut health. It's the summary of the microbiome health. A maximum score of 40. Anything above 30 is excellent. And then on testing, you can go through and you can assess the 4 key gut health indicators: alpha diversity, beta diversity. You can get gut restome index and pathogen control index. So many different ways of looking at all of this. So let's spend a couple minutes going through this for just a second. The new indicators that we can look at. When you have alpha diversity, which I mentioned first, this is the average diversity of species in your gut. So low alpha diversity suggests you've been near a lot of antibiotics, stress, toxins, diet's not been as good. Higher alpha diversity is paramount to health because then you improve the microbiome. How about the beta diversity that's on here? This is the overall composition and variation of species when compared to a healthy population. The high delta diversity is important if it's in the middle of the cluster. The low tends to be away from the cluster. So we can look at many different aspects of this as well. The resistome, this section explores the richness and stability of your gut microbiome by comparing the resilience of your gut microbiome to the healthy populations. Low resilience can indicate an increased risk for antibiotic-resistant infections. The pathobiome, low levels of pathogens can be normal and characteristic of a healthy, diverse gut microbiome. Increased levels, however, can indicate that a pathogen is playing a role in symptoms that you may be experiencing. And then, of course, there's the ratio of what happens with dysbiosis. The ratios are key. This section looks at the abundance of important groups of bacteria between your gut and the typical healthy gut microbiome. Elevated dysbiosis ratios for these bacteriophylla are a general point to disbalances in the abundance, so i.e. dysbiosis. This is associated, as we just said, with a wide range of health conditions. You want to look at the different functions that occur and look at amines, phenols, ammonia, indols, short-chain fatty acids, and of course, ammonia production. You can see your gut versus a healthy gut if they're not the same, and pathways of gut inflammation. Almost every disease you can think of after the age of 45 is inflammatory in nature. In fact, most diseases at any age are. A little bit of inflammation heals, too much inflammation causes a problem. And on this test, you can look at pathways of gut inflammation. So you can see if there's a methane problem, an ammonia problem, what is the actual balance? And then, of course, there are keystone species. What are the beneficial bacteria? We want those to be more diverse, and we want them to be a higher population. So this is a slide that is on the gut health test. Very important because this is the one I use with the patients. This is a nice summary looking at, on the left side, the phylum level of the US healthy patient, and then the next one is the phylum level by what the patient would have. So to give you an example of a patient and why I'm excited about talking about this test, I want to tell you about a patient that's 25 years of age, female, who delivered and 10 days later ended up in the OR and then the ICU. She had a volvulus. She infarcted off her entire ileum all the way to the ileocecal valve. In fact, if you look at the Annals of Surgery in 1978, it says 25-year-old white female, youngest patient ever with a volvulus. That person did spend an entire month, as I said, in the ICU. So if you lose your ileum, you never have a healthy gut. How would you go by and try and fix this gut? This particular patient tomorrow will be 66 years of age. And for the first time, because this kind of testing is available, where you can personalize the approach and you can really look at better diversity that's measured in a better way, now has a healthy gut. That person is me. Yes, I will be 66 tomorrow, and I no longer have any gut symptoms whatsoever. So the BioMe FX stool test is a new generation of testing. Please take a look at it. Right now, there's a 10% off on looking at this test. So you can see, you can just call 904-940-2208 or email. And this offer of the testing discount does expire on August the 7th. So for overall GI health and a strong immune system, have the patient keep in mind that they should eat to live, not live to eat. That there is an availability now through a functional anti-aging medicine approach to do world-class testing and help every patient have optimal health, an optimal immune system by having a healthier GI tract. Questions?
Hey, Dr. Smith, I'm looking at the chat box. There were a couple of questions about price and the company, and I answered those.
Okay.
Great job.
Perfect. Thank you so much. Thank you, everybody.
Great. Great. Thank you. Thank you, Dr. Smith. And thank you, everyone, for joining us today. And a special thank you to Tom from Virtual Practices and to our sponsor, Microbiome Labs. We will see you next Tuesday. Have a good night.